The last two exercises that I'm going to present for you as a part of this series are specifically targeted for anxiety. I did not come up with either of these exercises, or in fact any of the exercises in this video. These are just simple things that I've learned over the years. And please come up with some more clever names than what I have come up with for these two, because they're really just based on numbers. They work very good for anxiety, both generalized anxiety as well as that involves panic. And let me tell you, some of the longest visits that can go on and on, whether in a counseling office or in a primary care office, have to do with anxiety. Because when you have a patient that's in the middle of a panic attack, you can bet that patient keeps you in the room for a while. So this is very effective in keeping your clinic running and moving on time. So the first one that I want to present to you is just simply called the 5x5. And this is very good for a person right in the middle of a panic attack, or you could teach it as just kind of a device for them to use when they are high anxiety on their own. So the 5x5. So what you do is you look at them straight in the face, especially if they're having a panic attack, and say, hey, listen, I want you to do exactly as I say. I want you to name 5 things that you can physically see around you, and have them call these things out loud. No, they can't say the same thing twice. Have them call them out loud. So if I was doing this right now, I'd be like, oh, well, you know, I can see the lamp, I can see the chair, the table, this picture behind me, my necklace, and the floor. Okay, that's 5 things. Then immediately you're gonna say, okay, I want you to name 4 things that you can physically touch. These have to be different things, right? So I can touch my nose, I can touch my hair, I can touch the air. Again, they can be really creative with this. And I can touch my fingernail, okay? Immediately, once they're done with that, 3 things that you can hear, okay? So this is where it gets a little bit more difficult. So if I was to say that right now, I could say I can hear the sound of my voice, I hear a bell outside, and I hear the air conditioner. 2 things that you can smell. Again, they have to get a little more creative. You'll notice this is kind of a step down pattern. 2 things that you can smell. I can smell this pineapple and the coffee that I just made, okay? And then make them name, say, I want you to name for me 1 thing that you can taste. I can't taste anything right now. Yes, you can. Even if they say something like, okay, well, I taste my breath. Okay, very good. Now, you gradually go down 5, 4, 3, 2, 1 in that order, because as you're going through that, what's happening in the brain, when somebody is in a panic mode, they are really, the part of the brain that's lit up is really the reptilian part of the brain, right? So it's not really the higher order processing. It's just kind of the fear areas of the brain, and they're just kind of in that freak out mode, and really they need somebody to slap them, but we can't do that. So things like this 5x5, what it does is it starts really easy at the top to be able to name, 5 things I can see, then 4 things I can touch. But then gradually as you go down, you're having to work harder. They are having to work harder to start coming up with these more difficult concepts. And you know what that's doing is it's gradually forcing the focus of the brain from the amygdala in the fear area up into the neocortex, where it needs to be in order for them to think logically. So that's what you're going for. I've used this in the hospital. I've used this in the psych hospital. I'm telling you, it's very effective. It's called the 5x5. Remember, 5 things you can see. Make them shout it out loud. 4 things you can touch, 3 things that you can hear, 2 things that you can smell, 1 thing that you can taste, okay? And they can repeat this exercise on their own anytime that they feel anxious, scared, overwhelmed, because it's gonna force that thought process up, and they're gonna be able to think logically and then talk to you logically, and then you can help them out of the room. And obviously refer them, to a therapist or medication, whatever needs to be done after that. But that's called the 5x5. The last exercise I have for you is called the 7x7. I warned you, the names were not very creative. This one is deep breathing. And I will tell you, I've heard doctors say it, I've heard counselors say, oh, just do some deep breathing. Well, a lot of times the reason deep breathing is very effective, absolutely. The reason why people don't do it is because they don't do it long enough for it to be effective. And so what the 7x7 is And this, I would suggest, younger kids are not going to be able to really do this one unless they're pretty mature for their age. But I would really do the 7x7 probably on maybe 10 and up, even 12 and up. And all you do, very simple, is you're going to tell them, listen, I want you to, when you're feeling anxious, feeling overwhelmed, I want you to just breathe in for 7 seconds. You're going to hold it for 7 seconds. And you're going to exhale for 7 seconds. And you're going to do that, guess how many times? 7 times. Hence the name 7x7, okay? Now, the reason why this is so effective, and again, I use it myself. I have been using it since I'm still in nurse practitioner school, right before test. Very effective, because what's happening is when you are anxious and you're processing down in that amygdala, that fear area, and you're not thinking so logically necessarily, and your body is physiologically going crazy because, you know, fight or flight is happening, right? And you feel like you're going to run away. What you can do is, if you can tone up that vagal nerve, okay, increase the vagal tone. Well, guess how we do that? We deep breathe. And you know what? If I can't control my body physiologically and it just wants to be anxious on me, you know what I can do? I can do deep breathing, and that will force my body via the vagus nerve to calm down and think logically. So again, it's called the 7x7. To demonstrate it, I would say, okay, let's breathe together. We're going to inhale 7 seconds. 1, 2, 3, 4, 5, 6, 7. We're going to hold for 7 seconds. And we're going to exhale for 7 seconds. And you're going to do that 7 times. Do it the full 7 times. The other reason why that's also a really good exercise is because you don't look any different than anybody else when you're practicing that. You're not physically really doing much. You can be driving in your car and do that exercise. And if you're skeptical about either the 5x5 or the 7x7, you know what? I want you to try it. I dare you to try it. Do all 7 breaths, and I think you'll be amazed at the mind space that you find yourself in when you're anxious. Because inevitably, we all get anxious, you know, and we choose ways to manage it. But, you know, if you yourself are feeling anxious, try it. So I hope these have all been really helpful tips for primary care. Again, you don't have to be a therapist to do any of these interventions. They're very surfacey, they're very teachable, and they will give your patients something to chew on until they can get into that professional, and give them something that you can do on the spot. It's kind of like a lidocaine patch, I would say, right there. It's not going to cure the problem, but it's really good to fill the space until you can get somewhere or to a specialist that can focus on really dealing with that problem. Thank you so much. I hope this is helpful. Bye-bye.